You may be taking vitamin B12 every single day, believing you are protecting your memory, your energy, and your nerves, but what if the way you are taking it is quietly preventing your body from ever using it? This is something almost no one talks about because supplements feel simple, they feel safe, and they feel like control. But after 60, your body changes in ways that make those assumptions dangerous. Most people believe that if a vitamin is good, then more is better, or at least consistent use guarantees results, but vitamin B12 does not work like that. Especially in older adults, absorption becomes the real issue, not intake. And that is where the silent mistake begins. As we age, the stomach produces less acid, and that acid is essential to separate vitamin B12 from food, and even from certain supplements without enough stomach acid. The vitamin passes through the digestive system without being properly absorbed, which means that even if you take it every day, your body may still be starving for it. This is why many seniors who believe they are doing everything right still experience fatigue, memory issues, numbness in the hands and feet, and even balance problems. And here is the part that makes this even more dangerous. These symptoms often appear slowly, almost invisibly, and are frequently mistaken for normal aging people. Think it is just getting older, when in reality, their body is lacking something essential for proper nerve function and brain health. And the longer this goes unnoticed, the more difficult it becomes to reverse some of these effects. What makes this situation even more concerning is that many common medications used after 60, such as acid reducers, can further reduce the ability to absorb vitamin B12, making the problem even worse without you realizing it. This is where the real problem begins, because most people focus on how much vitamin B12 they are taking, but almost no one asks whether their body is actually absorbing it and using it properly. And without proper absorption, the vitamin becomes almost useless, passing through your system without delivering the benefits you expect. One of the most common mistakes seniors make is relying only on standard tablets that need to be broken down in the stomach. These forms depend heavily on stomach acid and intrinsic factor, both of which naturally decline with age. And this means that even if the label says you are getting enough, your body may only be absorbing a small fraction of that amount. This is why some older adults who take vitamin B12 regularly still experience low-energy brain fog and even worsening nerve issues, because the problem is not intake, it is delivery. And if the vitamin never reaches your bloodstream in the right way, your cells cannot use it. There are alternative forms such as sublingual tablets that dissolve under the tongue and bypass part of the digestive process, as well as liquid forms, and in more severe cases, injections, which deliver the vitamin directly into the bloodstream. These methods can make a significant difference, especially for those who already have absorption difficulties, but even with the right form, timing also matters. Taking vitamin B12 alongside certain medications, or even with heavy meals, can reduce its effectiveness, and many people unknowingly combine habits that cancel out the benefits completely. And here is what most people never realize. The body stores vitamin B12 in the liver, and deficiencies can take years to show clear symptoms, which creates a dangerous illusion that everything is fine until the signs become more serious and harder to reverse. This is why early signs are so often ignored or misunderstood, because they do not appear as something alarming. At first, you may feel slightly more tired than usual. You may notice small memory lapses or a subtle loss of balance, and these changes are easy to dismiss as part of aging. But in many cases, they are early signals that your body is not getting the vitamin B12. It needs vitamin B12 plays a critical role in maintaining healthy nerve function and producing red blood cells, which carry oxygen throughout the body when levels begin to drop, even slightly. The effects can ripple across multiple systems, leading to fatigue, slower thinking, reduced coordination, and in some cases, tingling sensations in the hands and feet over time. If the deficiency continues, these symptoms can progress into more serious issues, such as difficulty walking, increased risk of falls, and even cognitive decline. And this is where the situation becomes truly dangerous, because once nerve damage begins, it can be difficult to fully reverse, especially if it has gone unnoticed for too long. Another factor that complicates this is diet. Many seniors reduce their intake of animal-based foods, such as meat, eggs, and dairy, which are primary sources of vitamin B12. While this may be beneficial for other health reasons, it can unintentionally increase the risk of deficiency if not properly balanced with the right form of supplementation. And yet, despite all of this, many people continue to follow the same routine, taking the same supplement in the same way, believing they are doing the right thing, without realizing that their body is slowly becoming depleted. The truth is not that vitamin B12 does not work. It is that the way it is taken must adapt to the body as it ages, and understanding this difference can be the turning point between gradual decline and maintaining strength, clarity, and independence for years to come. So what is the right way to take vitamin B12 after 60? The answer begins with choosing a form that your body can actually use, because as we have seen, absorption becomes the central issue, not just dosage. And this is where many people need to make a simple but powerful adjustment. Sublingual vitamin B12, which dissolves under the tongue, allows the nutrient to enter the bloodstream more directly, reducing dependence on stomach acid and digestive breakdown. For many older adults, this alone can significantly improve how the body responds compared to standard tablets that are swallowed. Liquid forms can also be highly effective, especially for those who have difficulty swallowing pills or who want more flexible dosing, and in cases where deficiency is more advanced or symptoms are already present, healthcare providers may recommend injections which bypass the digestive system entirely and deliver the vitamin directly where it is needed. But form is only part of the solution. Timing and consistency matter just as much. Taking vitamin B12 on an empty stomach or at least away from heavy meals can improve absorption, and being mindful of medications that interfere with stomach acid can help prevent the vitamin from being blocked before it even has a chance to work. It is also important to understand that more is not always better. Taking excessively high doses without proper need does not guarantee better results, and in some cases can create imbalances or mask underlying issues. The goal is not excess, it is effectiveness. And perhaps most importantly, regular monitoring can make all the difference. Simple blood tests can reveal whether your current routine is truly supporting your body, or if adjustments are needed. This transforms supplementation from guesswork into something precise and intentional, giving you control over your health in a way that actually works when you begin to take vitamin B12 the right way. Something important starts to happen slowly but noticeably. Your energy becomes more stable, your thinking feels clearer, and your movements become more confident. These are not dramatic overnight changes, but steady improvements that build over time and restore something many people assume is permanently lost with age. This is because vitamin B12 is deeply connected to the systems that allow you to live independently. Your nerves, your brain, your circulation. When these systems are supported properly, the difference can be felt in everyday moments walking without hesitation, remembering small details, feeling present and alert throughout the day. And this is where the real message becomes clear. Aging is not simply about decline, it is about adaptation. The body changes, but it also responds when you give it what it needs in the right way. Small adjustments like changing how you take a vitamin can create results that feel disproportionate to the effort involved. Many people search for complex solutions, expensive treatments, or dramatic interventions, when in reality, some of the most powerful changes come from understanding the basics and applying them correctly. Consistency, awareness, and respect for how the body works over time. These are the foundations of long-term health. Every decision you make each day, whether it is how you eat, how you move, or how you supplement, is shaping your future, not in large visible steps, but in small, quiet ones that accumulate and define how you feel months and years from now. So take a moment to reflect on your current routine. Are you simply following a habit, or are you making a choice that truly supports your body if this brought you a new perspective? Share one thing you will change starting today, and if you know someone who could benefit from this information, pass it along, because sometimes the smallest insight can protect years of life, strength, and independence. Another mistake that often goes unnoticed is the assumption that feeling slightly better means everything is already working as it should. But the body does not always signal improvement in obvious ways, especially when it comes to nutrients like vitamin B12, which operate quietly in the background supporting essential systems. Many seniors adapt to a lower level of energy without even realizing it. What once felt like sharp thinking becomes slower processing. What once felt like steady movement becomes cautious steps. And over time, this new baseline starts to feel normal when in reality it is a gradual decline that could have been prevented or even reversed. This is why paying attention to subtle changes becomes so important. Noticing how you feel in the morning, how quickly you recall information, how stable you feel when you walk. These small observations can reveal more about your health than you might expect. And they often point directly to whether your current habits are truly supporting your body. Another critical factor is consistency, not just in taking the vitamin, but in taking it correctly over time. Irregular use or inconsistent timing can prevent your body from maintaining stable levels, and this can lead to fluctuations that affect how you feel day to day, creating cycles of improvement followed by unexplained fatigue or mental fog. Hydration also plays a role that is often underestimated. The body relies on proper fluid balance to transport nutrients efficiently and without adequate hydration. Even well-absorbed vitamin B12 may not be distributed as effectively throughout the body, reducing its overall impact. And while all of these elements may seem small on their own, together they create a system that either supports vitality or slowly erodes it. Understanding how these pieces connect allows you to move from guessing to knowing and from hoping to actually improving your health in a measurable way. There is also a deeper layer to consider, and it is something that many people never fully explore. Vitamin B12 does not work in isolation. It interacts with other nutrients in the body, particularly folate and vitamin B6. And when these are out of balance, even a good intake of vitamin B12 may not produce the results you expect. This is why some individuals continue to experience symptoms despite supplementation, because the body functions as a network, not as separate parts. When one element is missing or misaligned, it can affect how everything else performs, creating a chain reaction that is not always easy to detect without proper awareness. For example, low levels of folate can interfere with how vitamin B12 supports red blood cell production and nerve health, while imbalances in vitamin B6 can affect neurotransmitter function, which plays a role in mood and cognitive clarity. And when these factors combine, the effects can feel confusing, inconsistent, and difficult to trace back to a single cause. This is where a more complete approach becomes valuable. Rather than focusing on a single vitamin, it is often more effective to support the body as a whole, ensuring that all the key nutrients are present and working together in harmony. This does not mean complexity. It means alignment. Another aspect that deserves attention is gut health. The condition of your digestive system directly influences how well nutrients are absorbed and utilized. Issues such as inflammation, imbalances in gut bacteria, or reduced digestive function can all limit the effectiveness of supplementation, no matter how high the quality of the product may be. And this brings us back to a simple but powerful idea. The body responds best when it is supported as a system, not when isolated pieces are addressed individually. Understanding this can transform the way you approach your health, making each decision more intentional and far more effective over time. When you begin to align these factors, something remarkable starts to take shape. Your body becomes more responsive, your mind feels more present, and your movements regain a sense of stability that may have seemed out of reach. This is not about reversing time, but about working with your body in a way that allows it to function at its best. Given the stage of life you are in, it is important to remember that aging is not a uniform process. Each person experiences it differently based on their habits, their environment, and the choices they make daily. This means that small improvements in routine can lead to meaningful differences in outcome, especially when applied consistently over time. Many people underestimate the power of simple corrections. Adjusting the form of a supplement, paying attention to timing, supporting related nutrients, and maintaining hydration. These actions may seem minor, but together they create a foundation that supports long-term strength and clarity. There is also a psychological shift that occurs when you take control of these details. Instead of feeling at the mercy of aging, you begin to see that there are areas where your actions directly influence how you feel. This sense of control can improve not only physical health, but also confidence and overall well-being. The goal is not perfection, it is awareness. Understanding what your body needs and responding to it with consistency and care. This approach removes uncertainty and replaces it with a clear path forward, one that is based on knowledge rather than assumption. And as you continue to refine your routine, you may find that the changes you experience extend beyond physical improvements into a broader sense of vitality and engagement with life itself, showing that even small adjustments can have far-reaching effects when they are applied with intention. At this stage, the most important thing is not to feel overwhelmed, but to recognize that meaningful change often begins with a single adjustment. Choosing a more effective form of vitamin B12, paying attention to when you take it, staying consistent, and observing how your body responds. These are simple steps, but they create momentum over time. That momentum builds into noticeable improvement. Your energy becomes more reliable, your thinking feels sharper, and your balance more secure. These are the kinds of changes that protect independence and allow you to continue living life on your own terms without unnecessary limitation. It is also worth remembering that no supplement replaces a balanced lifestyle. Nutrition, movement, rest, and mental engagement all contribute to how your body functions. Vitamin B12 is one piece of a larger picture, and when it is supported by healthy habits, its impact becomes much more powerful. Many people look for quick solutions, but lasting results come from steady habits repeated over time. And this is where the real opportunity lies, not in dramatic changes, but in consistent ones that align with how the body naturally works. Every day presents a new chance to reinforce those habits, to make choices that support your future rather than limit it. And while no one can control every aspect of aging, there is always a level of influence that remains within your reach. So take what you have learned and apply it in a way that fits your life. Start with one change, observe the difference, and build from there. Because the path to strength, clarity, and independence is not built all at once. It is created step by step through decisions that respect the body and support it as it continues to carry you forward. Before we finish, take a moment to consider this. Many of the changes people associate with aging are not caused by time alone, but by small deficiencies and habits that go unnoticed for years. And when those are corrected, the body often responds in ways that feel surprising. Even encouraging vitamin B12 is just one example, but it represents a larger principle. The body needs the right support delivered in the right way. And when that happens, even later in life, improvement is not only possible, it becomes expected. This is why awareness matters more than ever. Understanding how your body changes allows you to adapt rather than simply accept decline. And that shift in perspective can redefine what aging looks like for you. If this has given you a new way to think about your health, take a moment to reflect on one change you can make, starting today, and follow through with it. Consistency will always outperform intention alone. And if you found value in this, share it with someone who might benefit, because information like this can quietly change the course of a person's life, helping them maintain strength, clarity, and independence for years to come. Thank you for staying with me until the end, and remember, your health is shaped by the decisions you make each day, and even the smallest adjustment, when done consistently, can lead to a stronger, more confident future. And if there is one final idea to carry with you, it is this: your body is always responding, even when you are not paying attention. Every choice, every habit, every small routine is shaping how you feel and how you function in the years ahead. And while it is easy to believe that decline is inevitable, the truth is that much of what people experience can be influenced by simple, consistent actions. Vitamin B12 is not a miracle, but it is a powerful example of how something small can make a meaningful difference when it is done correctly. It supports the systems that allow you to stay independent, to think clearly, to move with confidence, and to remain engaged in the life you have built. What matters most is not perfection, but awareness and action. Understanding what your body needs and giving it that support in a way that actually works for you. This is how strength is maintained, not through complexity, but through clarity and consistency. So moving forward, do not just follow routines. Question them, adjust them, and observe how your body responds. Because the more aligned your habits become with your needs, the more you will feel the difference in your daily life. Your future is not decided in a single moment. It is built quietly, day by day, and with the right choices, those days can remain active, clear, and full of possibility for far longer than most people expect.